If you've been dealing with sharp shooting pain going down your leg every time you sit, drive, or even while you're at work, if so, you might have sciatica, one of the most common causes of nerve and lower back pain. In this video, I'm going to describe exactly what sciatica is, what causes it, and more importantly, I'm going to show you 4 exercises you can do to get out of sciatic pain fast. So if you're dealing with back pain and pain down your leg, this video is for you. Hey guys, I'm Dr. Kevin Vandy, specialist physical therapist, here to tell you 4 ways you can quickly get out of sciatic nerve pain. But first, before we get there, I want to tell you exactly what sciatic pain is and why it happens. So what is sciatica? You've likely heard the term, maybe you were told by your doctor or a friend. Sciatica refers to a condition of nerve irritation and inflammation that starts at your lower back and can cause pain either in the low back itself, very often at your butt, right where your buttocks muscle meets your lower leg and your hamstring. It can happen in the hamstring, behind the knee, or even into your calf. So you have nerves that exit from your spine, from the sides of your spine, called nerve roots. And those nerve roots bunch together in your lower lumbar and sacral nerve roots. There's a group of them that bunch together and form your sciatic nerve that then travels through your sciatic notch, which is a hole in your pelvis, the bottom of your pelvis, and then down the back side of your leg. It's actually the biggest nerve root in your body, and because it's big and travels past some key structures, it can get irritated. Now, what causes that irritation? You can get a disc bulge like you see here. These are your spinal segments, the bones here. The in-between parts are your lumbar discs. Now, your lumbar discs are filled with fluid. And what happens in that fluid, if you bend forward, the fluid then starts to push back in the posterior lateral parts of the disc. It can wear away or decrease the strength of the parts of the disc where the nerve sits, and it can bulge out. You can get a herniation like you see here. That herniation then pushes into the nerve root, causing inflammation, and that's how you get pain down your leg. Now, you could have leg pain, for instance, in your hamstring or in your calf that's sharp shooting. It feels like nerve pain, but it's not from the hamstring or calf. It's actually from the spine where the nerve root's getting impinged or where the bone is pressing on the nerve. You can also have osteophytes, which are bone growths that fill in the foramen or holes where the nerves come out. That bone can hit the nerve root and also be a trigger for sciatic nerve pain. It can be tricky though, because you may feel like you pulled a hamstring, or you may feel like you pulled a calf. The difference is nerve pain is usually a shooting pain, a sharp pain, stabbing pain. You usually get it when you're inactive, when you're sitting for too long, bending forward, you're in your car or you're at work, or transitioning from sit to stand. Those are all places where you're going to get nerve pain, but you're not necessarily using your muscle that much, so it's not a muscle strain, but it's sciatic nerve pain. Now, sciatic nerve pain can be really sharp, it can be really uncomfortable, and it can get to the point where you just are trying to find some relief just to get out of pain so you can do your normal day-to-day life, walk, sit, go to work, sleep, so forth. So what I'm going to show in these videos, I'm going to show you 4 exercises you can do to get out of pain fast. And there's 2 things we're going to do. One, we're going to mobilize your spine and nerve to give it room to move as you go through your daily life. But then I'm also going to show you 2 ways, 2 of the most common errors people make that agitate the sciatic nerve that you need to avoid in the acute stage of rehab so that you don't further injure the nerve as you're trying to get better. Some other things, risk factors. Most people who get sciatica are usually between the ages of 40 and 60 when you get naturally some degeneration of your lumbar discs, and more common for herniations. It's more common in people with diabetes and with people who sit or are sedentary. Walking is one of the greatest things you can do if you can tolerate it and that isn't a risk factor or something that bothers you. Getting out and being more active can be a great way to get rid of sciatic nerve pain. But let's jump in to the 4 quick relief pain exercises that I can show you today. All right, so the first drill you're going to use to get out of sciatic pain fast is called self-traction. And what this drill is, it's a drill to unload or take pressure off your lumbar spine so that the spaces where the nerve roots come out, you have increased space to allow the healing of the inflammation that's occurring at the nerve root. So you can use the back of a chair, back of a table, back of a couch, something that's sturdy like this table. Now the key here is, although you probably hear in doing core drills, you want to keep your core tight to protect your spine. In this drill, we actually want the opposite. We want your abdominal muscles off, and we want your upper body to be relaxed besides your arms holding your weight. So you're going to use the side of a table. You're going to lean your pelvis into the table so that the weight is supported on your hands. Your knees are going to be bent, and you're going to allow yourself, your lower body weight, your legs and hips, to sink into your arms. Again, relax your core and just press into the table so that you feel a relief or a release of pressure from your lower back area. Now, you want to hold this for 10 to 15 seconds. If it's hard on your wrists or if it's hard on your arms, you can also use your forearms and press up on a kitchen counter or press up on a table just to unweight and unload the pressure from your spine. You can do this as much as you want throughout the day. You can do it every hour. But if you're having that sharp stabbing pain in your leg and you just need some relief, self-traction is a great initial way to get rid of, at least temporarily, your sciatic nerve pain. So self-traction is the first exercise. Let's go to the next one. So the next drill you're going to do is a pelvic rocking drill. So your pelvis sits here, your hips and ilium, and when you rock your pelvis back and forward you can push a little bit with your feet, tighten up your abdominal muscles, pull your pelvis towards you. You can think of pulling your belly button towards you. Your abdominal muscles are going to contract a little bit, and then you're going to rock your pelvis the other way to elongate the front of your hips, and then rocking back will elongate the back of your hips. And you want to continuously rock back and forth. You can breathe out on rocking forward, breathe in on rocking back if you want to add some breathing to it. This pelvic rocking drill should be done for 1 to 2 minutes, and all you're doing is mobilizing the nerves in your lower back and in your legs. This can be a great relieving technique for sciatic nerve pain. The next drill is a standing hip flexor stretch. You're going to be using a chair or maybe a first few steps at your home to stretch out the muscle, your hip flexor that sits in the front side of your spine and attaches to your leg. When that muscle is tight, it can pull you into flexion or pull you into bending. That adds to the traction or elongation of your sciatic nerve and can cause issues. So what you're going to do, you're going to have one leg up on a chair like this. You want it to be approximately 90 degrees, and then your back foot is pointing forward. The knee is locked straight. You're going to keep your chest up, and you're going to lean forward until you feel a pull in your hamstring on this side. But now here's the key piece. You're going to rock your pelvis backward. So you could press your butt forward, tuck in your belly button, and you're going to feel a stretch in the front of your opposite hip. So if I show you on this side, here, leg up, you're going to chest up, move forward, and then rock the pelvis so that you feel a stretch in the front of the hips. You can also raise your arms if you want an additional stretch through your core and abdominal muscles. This can be done if you're out on a walk and you're experiencing sciatic pain, or you're at your desk and you need to use your, you're like, oh, I just got to get out of pain. Use your chair to do a quick stretch that doesn't need any additional equipment. You're going to hold it for a minute. You can do a minute on both sides. It can be a very quick relieving sciatic nerve pain stretch. There's one more drill I want to show you, one more exercise that's going to help alleviate sciatic nerve pain by realigning your pelvis. This final exercise I'm going to show you to alleviate sciatic nerve pain is a PRI, or Postural Rehabilitation Institute drill, called a right sine left adductor pullback. And the goal of this drill is to realign your pelvis, so when you're sitting and walking, your pelvis is in a more neutral position, so you decrease the impingement in your lower back, the nerves of your lower back, and you decrease the impingement in your hips. So you're going to use a ball. You can use a rolled up towel or rolled up pillow. That works as well, and you're going to be against a wall. So what you're going to do, lying against the wall, you're going to have the ball between your legs, your feet flat on the ground. Your body is going to be not rolled back, but directly in neutral. And what you're going to do here is your goal is you're going to take this top thigh and you're going to try to pull it directly backward. So you're going to drive it back behind you by rolling the ball backwards. When you do that, you're also going to press this leg into the ball. You're going to feel your left adductor, your left inner thigh muscle kick on. You want to make sure you don't roll your torso. That stays upright. So it's just the thigh is going to roll back, squeeze into the ball, and you're going to hold that. Take a nice deep breath. Breathe out till you can't breathe out anymore. When you breathe in, you're going to pull back even further and squeeze the ball so your adductor is really turned on, and you're going to take a deep breath again. Then when you breathe in, you're going to pull back one more time and squeeze. Again, this is going to really fire up your inner thigh muscle with the goal of realigning your pelvis. This can work really, really well at decreasing sciatic nerve pain. All right, so those are the 4 exercises you can use to alleviate sciatic nerve pain fast. The other 2 things I want to tell you about are things not to do. Things I see so frequently when people try to solve sciatic nerve pain that actually make it much, much worse. The number 1 thing is do not bend over or try to stretch first thing in the morning. You see, when you're lying down at night, your spine is horizontal. And when it's horizontal, your discs, which are have fluid inside them, they fill with additional fluid at nighttime, which is why you might feel a little taller in the morning. You actually are a little taller in the morning. And then as you go and work and walk around, that fluid moves out of the disc naturally. It's a natural process. But if you have a disc herniation or a disc bulge and the fluid moves into the disc, it can make that issue worse. So it takes up more space where the nerve root comes out and goes down the leg. So if you try to stretch in the morning, like bend forward and touch your toes or bend to shave your legs in the shower, that can really irritate the nerve roots that make up your sciatic nerve, and that could set off your pain for the rest of the day. So don't stretch first thing in the morning. The best thing to do, get up 10 or 15 minutes, walk around your house, grab some coffee, drink a water. Wait until, if you have soreness in the morning, wait till it goes away, but at least 10 or 15 minutes of walking and being standing is enough to have some of the fluid move out of your disc, opens up some space for your lumbar nerve root, and makes it so you're not getting the same compression. So that's number 1 thing to avoid. Don't stretch first thing in the morning. Number 2, sciatic pain is often going to be felt in your buttocks or hamstring. When you feel it in your hamstring, it can feel like your hamstring is tight and you're going to want to stretch it. Sometimes that's appropriate, but oftentimes you don't have the mobility in your hamstring, and more importantly, you don't have the mobility in your sciatic nerve. So when you think you're stretching your hamstring, you're actually putting tension on the sciatic nerve, and that can cause even more issues. So one of the best things you can do when you have very acute, new, very sharp sciatic pain is to stop stretching your hamstring. Again, it seems counterintuitive, but even if just for 2 weeks you stop stretching, it can make a big difference at reducing the overall inflammation at your sciatic nerve. So to review, don't stretch in the morning and avoid stretching your hamstring, at least for the first few weeks while you let your sciatic nerve calm down by doing these 4 exercises and drills. So there you have it. There's 4 drills you can do to quickly reduce sciatic nerve pain, and 2 things you can stop doing that's likely making the issue worse. Hey guys, it would mean the world to me if you got value from this video. Please like, subscribe, hit the bell to get more notifications when my next videos come out. And until next time, everybody, train smarter and perform better.